Hi everyone, welcome to Pediatrics Simulation. We are so excited to have you today. There are a few things we want to show you before we start. Here at the Sim Center, your safety is our priority. Now let's head on inside the Simulation Center. There are quite a few things you will have access to while you're caring for our pediatric patients in simulation. Now let's go to the patient room and look at all the equipment available to you. Does anyone recognize what this is? It is a pediatric crash cart. It's also called a Braslow cart. Before we care for our patient, let's do hand hygiene. There are hand sanitizers available and even a patient sink if you choose to wash your hands with soap and water. PPE are also available outside the patient room. Let's meet Jay, our patient for today.
Hi everyone! Thank you for being my nurses today. But I think you're forgetting something. How do you know I'm your patient for the day? Check my wrist. My name is Jesus Rodriguez, 6/24/2000XX. Before my nurses start, I think it's a good idea to check to see if all the equipment works. Agree? There are a couple things on the wall you need to see. I think they call this one oxygen. This actually works. See? I'm not sure what this one's called, but I know it's like a mini vacuum that sucks my spit, or if I throw up. You see the picture. Lastly, there is a blue button right here that nurses tap on if I were to stop breathing or my heart stops. Can you hand me that green thing? My nurses give me that if I have to spit, and sometimes the big one if I have to throw up. And you know my bed? It has lots of arrows. The arrows outside the bed controls the height of the bed, and the double arrows inside controls the height of my head or my feet. Can you please raise my head? Thank you. Let's look at that big TV I have. Do you recognize the numbers? For my blood pressure, you just need to touch that button. Do you see it? It says start and stop. I know it doesn't hurt. It's just going to give me a nice arm hug. When you check me, there are things that you can actually hear with your hearing instrument. I think some nurses call it a stethoscope. Is that what you call it? I forgot. You can actually hear my lungs, my heart, and my tummy. If you put your fingers right here, you can feel my pulse. But it only works on my left side. I have another one right here on my arm. You can feel it too. Do you feel it?
Thank you, Jay. Now let's talk more about equipment. Do you see this IV pump? Use it. You can turn it on and set it up based on the doctor's orders.
You can also access his IV. You can check for patency, give him an IV push, or connect him to any IV tubing.
Here is another cart that has all the supplies that you need, from IV tubings to syringes, respiratory supplies, flushes, alcohol wipes, you name it. Make sure you open up these drawers. Our motto here in simulation is clean as you go. Here is a gray basin where we need you to put all of the used syringes, caps, IV bags, and tubings. Don't throw them away. Another equipment in our patient room is our workstation on wheels. They're called WOW. This is where you will log in to your electronic health records and document. The scanner actually works, so when you're ready to administer your medications, go to your MAR, scan the patient, and scan the medication and go through your medication rights.
My name is Shivam. I'm going to be your nurse today. I'm going to give you this medication. Can you tell me your name and date of birth?
Jesus Rodriguez, 6/24/2000 XX.
Okay. Thank you.
There you have it. You're more than welcome to visit the patient room before you start simulation. Simulation may begin.